Public health officials say the world's first confirmed case of multi-drug resistant gonorrhea has been reported in the UK. Health experts have expressed concern about the rise of drug-resistant strains of gonorrhea, but until now, doctors have usually been able to treat the sexually transmitted infection with a combination of commonly used medicine.
The clap is clapping back. Antibiotic resistant supergonorrhea is one of the biggest global health challenges that we are facing in the 21st century. Gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. Left untreated, or worse, if it's unable to be treated with antibiotics, it can lead to complications like pelvic inflammatory disease, which can permanently scar your reproductive organs, leaving you infertile for life. Antibiotic resistance arises because among the millions of Neisseria gonorrhoeae bacteria in an infection, by chance 1% will have a genetic mutation, which enables them to survive after drug treatment. The surviving bacteria reproduce and pass on their resistant genes to the next generation, and the cycle continues. Antibiotic resistant supergonorrhea is already at 5% in the Americas and Australia, and a whopping 30% in Asia and Europe, and will cost approximately $1.9 billion to the healthcare system in the US in 2020.
So, what are antibiotics? Antibiotics are a type of antimicrobial designed to target bacterial infections within the body. They do this by killing and preventing the reproduction of bacteria. Some of these are only effective against certain bacteria, while others, known as broad-spectrum antibiotics, attack a wider range. The main antibiotic used for gonorrhea is ceftriaxone, a type of cephalosporin which is commonly used in a combination of erythromycin. It is given as a one-time injection, which one dose of erythromycin is taken by the mouth. If the infection is severe, antibiotics need to be taken for a week or more. Ceftriaxone has side effects that include rash, diarrhea, nausea, and blood clots, which could lead to hemolytic anemia. It is a bactericidal agent that acts by selectively and irreversibly inhibiting the bacterial cell wall synthesis through inhibition of transpeptides or penicillin binding agents.
Hi, I'm Dr. John. Today one of my patients came into my clinic. He showed symptoms such as burning sensation during urination, testicle pain, and an abnormal discharge from the penis. I suspect he has gonorrhea infection, so I'll take samples from his cells from his body. This can include urine test. This may help identify any bacteria in the urethra and a swab of affected area, and this will be sent to the lab, which will identify the bacteria. If the results come back positive, we can cure it. Here in the clinic, we take a dual therapy approach, a single dose of 250 milligrams of intramuscular ceftriaxone and 1 gram of oral azithromycin. It is important for the patient to take all of the medication prescribed. By finishing the full course of antibiotics, the concentration of drugs in their body remains constant. If they do not take the full course, the concentration of drugs drops and therefore resistance is more likely to develop. While it will stop infection, it will not repair any permanent damage done by the disease.
Due to the increased antibiotic resistance of penicillin, new drugs have to be developed to stay on top of resistance. Zoliflodacin is an experimental antibiotic that is being studied for treatment of infection with gonorrhea. It has a novel mechanism of infection, which involves inhibition of bacterial type 2 topoisomerases. It is being developed by Intrasys Therapeutics and is currently in phase 2 clinical trial. Some of the social impacts with individuals with gonorrhea can face includes frustration, anxiety, anger, fear of rejection, isolation, guilt, embarrassment, shame, and feeling of physical filth or contamination. These negative psychological effects are potentially more important than the medical effects of the disease. Communication between a doctor and a patient needs to be improved to increase early intervention. The future of drugs used to treat gonorrhea. Due to gonorrhea strains exhibiting high levels of clinical resistance to extended spectrum cephalosporins, also known as ESCs, a recent discovery of 2 new antimicrobial combinations were evaluated. These include combinations of gentamicin or gemafloxacin with erythromycin and can potentially be used as an alternative treatment option for individuals who have ceftriaxone resistance, treatment failure, or even ESC allergy.
Over 200 clinical trials have been conducted of ceftriaxone since it was approved for use in the 80s. One study from 2012 showed that the cure rates for 250 milligrams of ceftriaxone were significantly better than cefexime, spectinomycin, and cefotaxime. This was a randomized clinical trial providing high-quality evidence and unbiased treatment assignment.